Hello and welcome to Juvenile Arthritis Explained. My name is Corrine Pinter. I'm a mom of a 15-year-old girl, Emily, who was diagnosed at 2 with juvenile polyarticular arthritis, and she today has psoriatic arthritis. Today we have with us, our guest is Dr. Leslie Favier, a pediatric rheumatologist at Children's Mercy Hospital. Dr. Favier is also a clinical assistant professor of pediatrics at the University of Missouri, Kansas City School of Medicine. Thanks for being here.
Thank you so much for having me.
How can we effectively communicate changes in our child's condition or symptoms during the virtual appointment when physical exams aren't possible?
Yeah. So, I've had families get creative. I've had them send me pictures and videos, either ahead of time or showed me during the video call. Um, Also, words are really important. In some ways, the patients or the parents are kind of my hands during this visit. So, feeling for swelling, feeling for warmth in the joints, and then, doing some range of motion. We can do that via instruction or, via me prompting if the parent to help. Is there limping with walking? Are we using, our utensils differently, or, holding our implements, our hairbrushes, our forks, differently, our pens? So words are really kind of the tool we use most, but we can also do some creative things with visuals too. Also, I like to say, if there's open space in the room behind you, I sometimes will have the kids stand back and we'll do some passive range of motion exercises. So not being in a really cramped room or like in a car could be helpful for that.
What should we do if our child is uncomfortable or resistant to virtual appointments? Are there strategies or anything we could do to make it more child friendly, maybe?
Yeah, it depends on the age of the child, right? So if we're dealing with a really small one, I oftentimes will make it kind of into a game or use reward systems on the parent end. We say, if we do really good for this next 15 minutes, then you'll get some M&Ms, or you'll get, to listen to a
Something.
nice song or whatever. I you can always tell us up front as a parent. You can say, hey, we're a little nervous, or we're not really loving this video thing. We feel a little awkward. And we can, maybe have them get their wiggles out. We can do some of our games where we have them move and bend, some of the familiar things they're used to. Or we can chat about, low stress things up front. We can say, how is gymnastics going? We can divert a little bit. But on the parent end, communicating up front about how it's going to go, what to expect, that can be helpful as well.
Mhm, mhm.
Teens are a different
They're different.
situation,
Yeah.
different approach for them. But that can be, if they're not feeling like they want to talk or open up, that can be really challenging. But
Yeah.
it's patient by patient that we kind of address that.
Right, right. And yeah, the teens would probably be easier because you could say it's like FaceTiming, FaceTime your doctor. Are there specific questions or topics that are especially important to address during virtual appointments?
My answer is all of the things that we think about with in-person, appointments. So the important face-to-face conversations, the worries, the concerns, the how is this going. In addition, though, I think it's really important to solidify the plan, really set in stone, because in the live in-person appointments, we are getting a paper
Right.
oftentimes that has, this is my checklist, this is what I'm going to be doing outside of here. I need to go to the radiology to get an x-ray. I need to go to lab. With virtual appointments, we oftentimes will get you this is our plan paper, but it may be coming on the portal. It may be coming via snail mail. And we want to make sure that nothing is lost in translation, right? So that we understand, hey, I'm taking them to this lab. This is how I'm getting the orders for that. We are doing this medication. We are doing this physical therapy. How am I getting all of these things in motion? That I think is the extra to do. And maybe the like downside to the virtual appointment is the communication really needs to be firm and seamless. Does that make sense a little bit?
Yeah, it does. Yeah. Because you do, you oftentimes end with here's your papers, here's a summary of what just happened. So how can we ensure that our child's treatment plan and medications are actually accurately managed and monitored through virtual appointments?
Yeah, so we want to make sure that we're staying up to date with our recommended clinic visit schedule, whether it's live or virtual. So those are typically based on, how severe the chronic condition is, or how frequently we need lab work or monitoring. So keeping up to date with those intervals is really important. I think it's really easy to get out of the habit of getting your labs drawn or your x-rays done. If you are in the virtual setting, kind of like we talked about before. So if you're, outside of the physical clinic space, what are some ways that we can really make sure that those extra things are being completed? Because we want to make sure that we're practicing safely too. And a part of that may be lab work. If we feel like, with the virtual appointment alone, that we're not getting the monitoring and the physical exam portion done, we can always add in a live visit. If we feel like, hey, this virtual appointment was a little bit limited because we weren't able to really feel the joint, we can always schedule a sooner live visit if needed.
Yeah. Yep, that's a good point too. And that goes into this next point is, can you explain the process of obtaining necessary lab work or imaging when needed? How do they fit into the rheumatology that's virtual?
Yeah, so if there's labs or imaging tests that are needed, we typically will provide orders to get them done. So if you live really far away from the facility where your rheumatologist is located, then we'll usually send you an order slip, and that can be via electronic means, or I've had some families get snail mail orders sent to them, or fax to the facility if hey, we have a lab we like to use locally. We'll send them and fax them over to the lab so they're waiting and ready. Then it's going to be the responsibility of the family to schedule a time. I usually say put it in your calendar, choose an afternoon, and write it down, put it in your calendar, so that way you can bring the child to the local lab or the local radiology department to get them done and completed. And that can be hard to remember.
Yeah. And it's going to be similar to in-person. It's just, you might not have access to everything all at one day at one time in one setting, where it's maybe today's our virtual appointment and I could get into labs by the end of the week or get into imaging in a couple days. So a little bit tricky with scheduling, maybe a little bit different.
Agreed.
Okay, lastly, so then again, now we're virtual. So now we need to transition either back in person, or we're in person and we have to go to virtual, and that can be difficult. So what should parents do if they have concerns about the effectiveness of virtual appointments instead of in person?
So I think there's no doubt that it's a really, it's a differing experience, kind of like what we talked about at the beginning. I think I have some families that really enjoy the opportunity to be face to face, and they feel a lot of comfort. And there's kids too that feel comfort in knowing that there's been a thorough exam and that they're safe and well cared for. So I do feel like we always offer the ability to switch. I have some families that switch in between live and virtual. So, every 6 months, we're doing a live visit, and in between, we do a virtual visit where we see how we're feeling. I have some families that do kind of a hybrid situation like that. But we do offer freedom that, if something's working, we pivot. If the virtual visits are not, what we both need out of the appointment, or can work both ways. There's providers who will say, hey, I really need to examine your joints. I really need to come in. And then vice versa, I have families who say, hey, we really want to come in for this. And so we'll pivot and work with you.
And I think it's just kind of case by case situation. I think with how the child's doing, how the treatment's going circumstantially. I mean, the one nice thing is when there are maybe some weather concerns or just transportation or travel concerns, it's nice. And then there's times that everything's just fine and we go in person and have our exam and it's all fantastic. So there's pros to both. I mean, I think we need both, actually.
I agree with you. I do.
Yeah.